Glycemic targets. Dr. Zainab Imara, family physician. Diabetes mellitus is a chronic metabolic disorder resulting in hyperglycemia, microvascular and macrovascular complications in individuals globally. It is a prevalent metabolic disorder characterized by a deficiency in the secretion of insulin or in its effect or both. Diabetes mellitus is a rapidly growing public health crisis globally with a huge burden of disease. Type 2 diabetes mellitus is highly prevalent. Up to 90 to 95% of the overall diabetic cases are type 2 diabetes. Despite its global attention and the effort by healthcare community, its incidence and prevalence continue to rise. In 2019, it was estimated that 463 million individuals are suffering from diabetes, and it is expected to rise to 578 million patients by 2030 and 700 million by 2045. Glycemic control in type 2 diabetes patients can be evaluated by using 4 parameters: glycosylated hemoglobin, fasting blood glucose, postprandial blood glucose, and the new method of assessing glycemic control are under evaluation nowadays as time in range. Glycemic assessment recommendations: assess glycemic status by hemoglobin A1C at least 2 times a year in patients who are meeting treatment goals and who have stable glycemic control. This is type E recommendation. Assess glycemic status at least quarterly as needed in patients whose therapy has recently changed or who are not meeting glycemic goals. Glycosylated hemoglobin is the gold standard for the estimation of glycemic control, followed by most guidelines, with recent recommendation for following time in range for more accurate assessment of glycemic control and targets. Regarding fasting blood glucose, the recommended target range is 70 to 130 mg per deciliter, and as set by the American Academy of American Diabetes Association, the range of the fasting from 3.9 to 7.2 millimole per liter, whereas the American College of Endocrinologists and the International Diabetes Federation set it as less than 110 and 100 milligram per deciliter respectively. The American Diabetes Association defines good diabetes control at a cutoff of glycated hemoglobin A1C 7%, whereas the American College of Endocrinologists set it at 6.5%. Continuous glucose monitoring is a useful tool to diabetes self-management, which includes meals, physical activity, and medication adjustment, particularly in individuals taking insulin. For the management of all diabetic patients, the key therapeutic goal is to maintain good glycemic control in order to prevent macro and microvascular complications. Rigorous recording and controlling of the level of the blood glucose is essential to diabetes care and management in order to delay and reduce the incidence of the complications. On the other hand, improving glycemic control reduces morbidity and increases life expectancy with improving quality of life of our patients. Continuous glucose monitoring serves an increasingly important role in the management of the effectiveness and safety of the treatment in many people with type 1 diabetes and in selected people with type 2 diabetes. Individuals on a variety of insulin treatment plan can benefit from continuous glucose monitoring to keep their blood glucose level in the target and improve glucose control and decrease hypoglycemia. Glycemic control is the optimal serum glucose concentration in diabetic patients. It is necessary to identify the factors that are affecting the glycemic control of the patient to prevent and control the complications. The prevalence of poor glycemic control was high. It is ranged between 450 up to 93% among different studies. Inadequate glycemic control leading to uncontrolled diabetes, which lead to many complications. These complications in turn can greatly reduce the quality of life of our patient and reducing life expectancy in addition to increasing the healthcare cost. Glycemic targets on size does not fit all. One size does not fit all as patient attitude, expectations, risk factors, disease duration, life expectancy, important comorbidities, estimated vascular complications differs from patient to patient with individualized approach. The glycemic control was associated with various factors. Some of these factors are related to the patient or medical condition, while others were related to the behavior of the patient and the medications administered. Maintaining blood glucose concentrations in the targeted range is essential to avoid severe complications. By continuous glucose monitoring, we target our time in range for our patient to be more than 70%, and the incidence of hypoglycemia to be less than 4% in most of our patients, and severe hypoglycemia to be less than 1%. On the other side, hyperglycemia need to be less than 25% and severe hyperglycemia to be less than 5%. Our hemoglobin A1C target to be less than 7% as mentioned before, according to American Diabetes Association. And according to the American Endocrinology Association, to be less than 6.5%, with different variabilities according to patient age and patient other comorbidities. The factors that are associated with glycemic control are stratified into 4 categories, like personal or body-related, clinical factor, medication-related, behavioral factors. Despite its importance, continuous glucose monitoring compliance has been found to be low due to these factors. And the identification of these factors is important to help getting our patient to the target level. These factors, the personal factors include age, education, cigarette smoking, gender, waist circumference, obesity, waist to hip ratio, family support for diabetes management, and the state of understanding the instructions of the physician and the pharmacist. The clinical factors that influence glycemic control of the patient include associated comorbidities, nephropathic complication of the diabetes, asthma, duration of type 2 diabetes, fasting glucose, postprandial glucose, time of the disease diagnosis, hypertension, history of hospitalization, microangiopathy, estimated glomerular filtration rate, level of cholesterol, and low density lipoprotein. Medication-related factors that affect glycemic control involve the drug regimen of glibenclamide and metformin, route of administration, number of antidiabetic, number of other daily regular drugs, insulin use, diabetes treatment regimen. The behavioral factor were the least reported factor affecting glycemic control of the patient, and they include low adherence, lack of physical exercise, nutritional behavior. And this is the reference, and thank you so much.